Hello, Assalamu alaikum. My name is Ihtasham and I'm from Department of BS Biotechnology and my roll number is 005. Today I'm here to present a presentation on the diagnosis for the bacterial infection. Let's first have a look what are bacteria. Bacteria are a type of biological cell. They constituted a large domain of prokaryotes, microorganisms. Typically, a few micrometer in length, bacteria have a number of shapes ranging from sphere to rods and spirals. Bacteria are among the first life forms to appear on Earth. They cause infection in organisms. There are other microorganisms also present in present which cause infection too, which are bacteria, viruses, fungi, and parasites. So, how does a doctor suspect infection in a human body? He does suspicion on the basis of person's symptoms by examining the physical condition of the person and on the behalf of the symptoms and the physical examination, he determine the risk factors and evaluate which kind of disease it could be or which kind of infection is causing these symptoms and physical conditions. For that, the first step doctor takes to confirm the person has infection or the kind of illness. Uh, they use different kind of tests and X-rays, CT scans, and a lot of other stuff to determine whether it's an infection or other kind of illness. Because both most of the diseases have same symptoms like cough and difficulty in breathing are symptoms of pneumonia, which is a lung infection, and it might be asthma or heart failure, which are not caused by infection. So symptoms are same, but the diseases and the cure are different for each uh, each of the illness or infection. So in the case of the cough and difficulty in breathing, they do X-rays to determine the infection uh, in the in the lungs or whether it's an other kind of a disorder. Once the doctor confirms that the person has an infection, now what will be his next step? Now he will do tests to find which kind or which specific kind of microorganism it is. Is it a new kind of bacteria or a old one which get mutant in the past time? In so for that he do many tests. Uh, Many organisms which cause a given infection. For example, pneumonia can be caused by virus, bacteria, and fungi. As I told earlier, that infections are not only caused by bacteria. There are other microorganisms also present which cause infection too. So it is very important to first know which kind of infection it is. Then, after knowing it, for the identification, they do some tests in the laboratories. They use samples of the blood, urine, sputum, and other fluids or tissues from the body. For they use these samples from the body and stain and examine under microscope and find out the structures of the viruses, because some of the viruses have a particular kind of structure by which by only watching it through the microscope they can tell that this disease is caused by this kind of infection, even until and unless it get mutant or it's a new kind of a microorganism. For that, and the next they use that cultured that sample from that they taken from the body and place it in the condition that encourage the growth of the microorganism. For that, by which they can evaluate by the numbers and the quantity of the new microbodies in that sample, that this is a type of which kind of microorganism is that. Next, they also do tests for the antibodies, means that molecule produced by person immune system. When a microorganism which cause infection enters into the person's body, the immune system of that person gets activated and fight against those harmful microorganisms. For that, they do tests and evaluate that which category of the micro antibody is more active, and so they can evaluate that the microorganism can be this type or that. Then they do tests for the microorganisms antigen molecules from the microorganisms that can trigger immune response in the body. They also do some genetic material test of the microorganism to check which kind of a microorganism, bacteria, virus, or fungi, parasite, which kind of it. By this genetic material test, they can evaluate uh, the microorganism. Now, after knowing the type of the microorganism, the next step they take by doing susceptibility test. What is susceptibility test? It is a test performed against the microorganism and check for knowing, for confirming the possible drugs that can particularly uh, cure the disease, cure the infection caused by particular microorganisms. So for the test, they use different kind of samples uh, from the body, and they take from these they take the sample from throat, urine, sputum, blood, stool, and wounds. Now we have a look on the how they take this samples from the particular areas of a body. For the throat culture, they insert a special swab, into the mouth to get sample from the back of the throat. It is kind of a stick which is used to take sample from the particular area where other instrument cannot be easily reachable. Then in the urine culture, urine culture tests are particularly done in those cases in which the person is uh, suspected to have infection in the urinary tract. So for that, the instructor asks the person uh, to give a sample of the urine in a cup, so they can check whether there is some infection in the urinary tract or not. Then they do a sputum culture. Sputum is a thick mucus that is coughed up from the lungs. It is different from the spit and or saliva. This type of test is used to uh, check whether bacterial infection is in the respiratory tract. That can include the diseases of pneumonia and bronchitis. For that, for the procedure, the provider asks to uh, cuff up sputum into the special cup. Or the other way for taking the sample is that they enter a special swab into the nose to get the sample from the person body. In the blood, then next is the blood culture. In blood culture, uh, They use to check the presence of any kind of bacteria or fungi in the blood. For that, they take blood from the arms veins and check for these kind of microorganisms. Then is a stool culture. This kind of test is performed when there is a possibility of food poison or other digestive illness. In in this type of test, they provide the laboratory. The doctor will ask you to give a sample of feces in a clean container and as instructed by the healthcare provider. Then it's wound culture. It is used to detect the infection on the wound or on a burn infection because there should be there can be a kind of a pus in the wounds, another kind of bacteria that can affect the wound badly and is getting bad and bad day by day. So in that case, the healthcare provider will use a special swab to collect a sample from the site of the wound. So now I'll give there are two examples for the bacteria which cause infection. Cocci is a bacteria which is round spherical shaped, and this is this is a bacteria uh, which is commonly cause cause pneumonia in most of the cases. The other one is Bacilli bacteria, which can be in the form of a single, pairs, or arranged in a chain form, and it causes many different diseases in the animals. There are a lot of other bacteria that I said earlier that they were the first living thing on this earth, which get mutant until now, and there are a lot of categories. So for that, for detection, it is very important to do these tests to cure for the 100% cure of the infection. Thank you. That's all from my side. Allah Hafiz.